Welcome to Indie Radio in Focus. I'm Prajakta, and today we have with us Communist Party of India Marxist leader and former Health Minister of Kerala, KK Shailaja. She received appreciation across the world after her successful stint as Kerala's health minister during the pandemic, after which she came to be known as COVID Slayer. A lot is being written about her since she refused to accept the Raman Magsaysay award recently. Let's hear what she has to say about her role during the pandemic, the significance of Kerala's governance, and what's there to come next. So, ma'am, the first question is, of course, pertaining to the COVID response of Kerala, and specifically how early Kerala started with the response when all the other states were still scrambling to understand what COVID is and what protocol has to be put in place. Kerala already had started preparing right when cases had started in Wuhan. So, what was the objective behind the early action in Kerala, and was it the experience that Kerala government had received while dealing with Nipah virus?
Yes, the first COVID case was reported in Kerala on January 30th, 2020. Actually, we started our preparation before that. I happened to read an article that a potential virus is spreading in Wuhan, and we discussed it together, my health secretary and other team. We sit and discussed it together, what shall we do if it come to Kerala. And there is a chance that there are so many Malayali students there in Wuhan, and because of the fear that they will come with the virus, we started our preparation early. January 24th, we had a very good rapid response team for this, and January 26th, we started our control room in State Director of Medical Service, Health Service Office. We started our control room, and we formed some expert groups to tackle the problem for collecting the materials and medicine, and also training and distributing these things. Everything we started early, and we waited, and we had a very good team for this tracing the virus even at the airport itself, and we trained them and we deployed them in the 4 airports. We have 4 airports there, and we deployed our health team there, and the persons come outside from foreign countries. We were examining whether they have any symptoms. Only we can check the symptoms at that time. We quarantined all these comers from other countries, these foreigners or not foreigners, the NRIs who come back. We quarantined all the people in their home properly, and if there is a symptom, we took them to hospitals and isolated properly. And that way we tried to contain or stop the spread of the virus. We got the first case in January 30th. We started the preparation in January 24th itself, but we got the first case in January 30th, and we admitted that medical student in Thrissur Medical College. And February 2nd, we got the second case, and that was in Alleppey. And the third student was the district called Kasaragod, and we admitted them in government isolation. No spread occurred out of them, and we totally contained or cut the spread, and we treated them well, and they cured and left the hospital within 2 weeks. And there is an interim period of 2 weeks. Everyone said it is over. No one will come back. But the restriction also, travel restriction also came at that time. But we didn't stop our work. We watched throughout the world, the news, the literature, everything. And we found that the virus is spreading to other countries like Italy, France, and USA, UK, etc. So we kept our vigilance as it is in the previous case. And we got that lesson from Nipah virus incidents, this tracing, quarantining, and testing, isolating. That was our slogan at that time. Taste, quarantine, test, isolate, and treat. At that time, WHO was saying, test, nothing else. But we didn't go like that. Testing everybody, that is not must. Testing the symptomatic cases, quarantining the suspected cases, and isolating the positive cases. That was our method in Kerala, and that worked well.
I think that was what was followed in the entire country later on, in the later waves. I mean, initially it was more of test, but later on they focused more on tracing rather than testing.
Yeah.
That was something you said Kerala has been doing right from the beginning. How much of a significance does a good health infrastructure hold in it? Because we saw this in other states also. On a national level, we saw this, that a lot of states, they were trying very hard to improve their health infrastructure after the pandemic began, after the caseload started increasing. Afterwards, there was thought about ventilators and about increasing bed capacity at government hospitals and everything. But we have read it time and again that Kerala has been working for it since LDF government came into power, even before that. So how much of a significance does that hold?
Yes, our slogan or our aim is to keep the virus, potential of the virus, under the health system capacity threshold, And we know what is our strength, and how much we can include or we can accept inside our existing system. But we anticipated the system may exhaust when the cases go up. And we started the preparation earlier, expecting or anticipating a worst case scenario. We started to strengthen our health system, and we decided to delay the peak of the virus. That was the most scientific and important thing. Some people are now criticizing that the peak occurred later in Kerala, but we are delaying intentionally the peak by breaking the chain of the spread and also quarantining and isolating, etc. We decided to delay the peak. During that time, definitely we got a breathing space to improve our health system. Other places they used the mitigation method, and the virus all of a sudden spread to the whole population, and they didn't get any time to improve their health system at that time. But we got some time. We worked hard to delay the peak of the virus, and at that time we were working, not only doing that thing, but we were working inside to improve the infrastructure, to making more ICU beds, to making more oxygen cylinders or oxygen supplied beds, and also to increase the production of oxygen. And we also formed some COVID first line treatment centers outside the hospitals. Some buildings we took over and furnished as COVID first line treatment centers. Then COVID second line treatment center, it is similar to a taluk hospital. We are getting the specialties also there, but we were furnishing it. Last time they planned, see, at last if the case go up to 50,000 a day, what shall we do? We thought it earlier, and we said all the local self governments that you should open a domicile care center in your panchayat. You can take a huge house or a theater or a reception hall, anything you can take over, and you can furnish as a domicile care center for the village people who got COVID and who have no facilities in their homes for isolation, and we can put the people there in domicile center. That way, we had planned each and everything, minute to macro things we planned and implemented with the help of the health community, the doctors, nurses, asha workers, not only them but with the help of the gram panchayat, the local self-government, and with the help of police department, revenue department. Everyone helped us. We planned like that, our protocol and our standard operating procedure. That is ours, health departments. But all other, we prepared this standard operating procedure to other departments also. How the police department should act during this pandemic, how revenue department should act. We prepared the SOP and we supplied, and the government has accepted it. Chief Minister said that everyone should obey the health protocol, and he is leading in front. He was, and that way, with the decentralized planning and action, and with the outlook and the anticipation about the virus, it is a scientific approach. We believed in science, and that way we were able to put this virus under the health system threshold.
Kerala's health model has been applauded a lot, especially since the pandemic, and globally it has received appreciation. But it wasn't just the health sector that functioned efficiently in Kerala at the time. We have read about the COVID support that was given, the welfare schemes that were run, and even in the sector of education, that Kerala excelled as compared to other states. So, what were the key factors in the success of Kerala in all these sectors, in all these areas? And how much of a role does the policy of the government or the ideology of the government and the party, how much of a role does it play in this success?
Yes, it is definitely a left-oriented policy, pro-people policy, we can say so. And during that COVID season, before it becoming a pandemic, we declared health emergency in Kerala. Our Chief Minister declared health emergency, anticipating that it will become a pandemic one day. It is a serious thing, highly infectious. We declared health emergency in Kerala, and also our government declared 20,000 crore worth package, especially for COVID. We are supplying the medicines, free medicines, free treatment. All of them, all the citizens were giving. We were giving treatment freely, whether they were admitted in a government hospital or they were admitted in a private hospital. If a COVID positive patient was admitted in a private hospital, we were giving the charge, all the treatment charge we were giving. And 2020, throughout 2020. That way, we decided to get the people in our part that they should get some enthusiasm that government is there, all will survive. That enthusiasm is the most important thing. Otherwise, people will become frightened and they will run here and run there, and they will succumb to death due to the scarcity of these facilities and also this oxygen, etc. No such chaos was happened in Kerala. Everyone was calm and quiet, and they were sure that if they caught COVID, definitely the government officials or workers will take them and admit them in the hospital and treat them, and they will send them back to the home. They were enthusiastic. That was the most important thing. We had opened hundreds of community kitchens throughout the state, and some volunteers prepared food from this kitchen and distributed to each and every home delivery of this cooked food. And we distributed some food kits to the families, to all families during the lockdown. Even rich families, we supplied the food kits. Some of them said that this is the first experience for us. Thank you for the government, but we cannot go outside to buy some food. And we are lucky that we got your package, etc. They have money with them, but they cannot move out to buy these things, essentials. That was the picture of at that time. And that way, through these packages, and we supplied medicines for the old age, the non-communicable diseases medicine in each and every home. For diabetic patient, we were supplying that the medicine for insulin, etc. No scarcity for any medicine or anything that way. And counseling, we trained thousands of counselors in the state, and under the leadership of our mental health wing, these fellows will call the COVID positive patients, and they have a talk with them, and they can release the tension and stress release. That is why the suicides were decreased in Kerala, and we were doing the counseling also during this time.
So the government was doing this. The government was going beyond the regular duties to do all of this. Now we are living in a time when we see how the country's power center is trying to push for privatization in all different sectors, and trying to push for privatization of all different public establishments in all different, even in the essential sectors, even in the essential services like health and education. In such a time, Kerala's approach and Kerala's success, what does that tell about the significance of state and the significance of good governance in achieving this?
Yes, what is meant by good governance? It means that the rulers are addressing the cry of the poor people and to supply the needs to the poor people. First, food. They should get food, and they should get clothes. They should get education. And when they grow up, after the 18-year-old, we should supply jobs to them. They should get wages. And that is the good governance, In our constitution, it is written that our country is a democratic country. And without giving opportunities for the people to enjoy their rights, how it become a democratic country? It cannot. What is the condition of the poor people in the villages in our independent country, especially in northern states? In city also there are rich people and rich business. It is happening. But what is the outskirts, the slums, Dharavi and other big slums? What is the condition of life there? They are not getting proper drinking water. What is the fate of women living in such an atmosphere? And that is why we are saying good governance means to give the whole people the opportunity to get education, get health, etc. In Kerala, we are trying to do that. It is not easy. This is federal system and all the taxes are going to central government, and we are getting only tax share from central government to rule. We have to do 65% of the social welfare activities as state's own responsibility, but we are getting only very meager share of the tax share, and with that we cannot do magic. But through decentralization, people's participation, and without corruption, we are utilizing the money. We are trying to do. Corruption is there in a capitalist country. Kerala cannot stand as an island among these things. But Kerala planned well, and Kerala enacted some laws in Kerala legislature, some acts in legislature, such 1957 onwards, staying the eviction by the landlords, and also to get public education. And this time we started for mission and last government 2016 to 2021 we started for mission. One is in health sector, Ardhra mission, and the other is education sector, to improve the infrastructure and also to decentralize the clinical practice to the primary level. And with the people's participation, we are implementing, we are doing some experiments, and we succeed in that experiments, Yes. That is, it is a Herculean task, but we are doing that, and we are getting some result out of that. That is why it become Kerala model. But we should have a sustainable model. Now, if a state have low income, running in low income, everything will collapse one day. So Kerala is trying to making the social welfare measures sustainable. That is why our Chief Minister said we are thinking to convert or transform Kerala society to a knowledge society, to developing skills and developing the entrepreneurship and making some kind of projects like that. And we are working for that, and some experiments or some reforms in higher education. We have to make higher education this current, according to the current era, technologically fit, and there is artificial intelligence is there, IT is there, and we should inculcate all these things to our education sector also. Without improving education sector, no society can improve to the contemporary style. And now Kerala is doing that to increase production and to good distribution, righteous distribution, etc. That experiments we are doing now, and all the major programs or projects should be there, like the high-speed rail and some water, metro, etc. That kind of thing. Same time, we are going to the grassroots level. We are examining whether the ration shops are functioning well, whether they are getting ration from the shops, whether they are getting the social welfare pensions, etc. We are examining that also. We are giving, there is a mission called Life Mission, We are constructing home for the homeless people, supplying them a 2-bedroom and one sit out and one kitchen and good toilet. That was the model of a life mission home. We are supplying this modern home to the poor people. Now we are working hard to maintain this Kerala model sustainable.
Taking a slight shift from this, I would like to ask you something about being a woman in a position of power, in a position where you can make a difference. How does it help people more? I mean, especially in the sector of health. We know we already have very few women political leaders. We don't have enough women political leaders who can lead us and who can participate in the policy making, which will actually help women, and not just women, but women, transgenders, everyone. So, do you think that being in that place at a crucial time, did it help make a difference for women? Did it help make the policies related to health more inclusive?
Yes, women should come to the forefront, Women's emancipation, everyone is saying about that. Women are working hard, but coming to the leadership, that is a question, because women should have to take the responsibility of home. That's a good thing, but women should not take it alone. It is a joint activity or collective responsibility, If it is not happening so, most of the women cannot come to the forefront, to the leadership. That is happening actually. We proved several times that women can do all these responsibilities and activities. When this reservation in local self-government come, someone said that, what is the fate of that Gram Panchayat? Women come as president. And women proved nothing happened. A good thing happened, They worked hard and they become good presidents and good chairmen, and they did well, very good project, etc. So, if we put a woman in a place, she can do it. There are some failures. There are failures among men. That no one is saying about that. If a woman failed, everyone is saying, look, the woman is in the chair and everything obtained. That is not a correct way. Most women are very good leaders and very good rulers. They can do everything. Women should come out. I think in Parliament and Assembly, the reservation should come. But India government is not passing this reservation bill. They are not even introducing it now. So 2 or 3 times they introduced and nothing happened. At the last moment, everything will change their mind. The other parties, only left party stands still in accordance with the bill. I think once that will happen, women will look the other countries, which are developing countries also. There are more participation of women in the decision taking bodies. But here in India, it is too low. That should change.
But ensuring more participation, or as someone like you, a woman is holding such an important position, does that help make the governance and make the policy making more inclusive?
That is according to the policy of the government, What is the policy? If women come to anywhere and everywhere, policy is not good, nothing will happen. There are so many women in capitalist ideology, parties which following capitalist ideology. Women are there, but nothing will happen, The focus is we should have to give to the ideology. If ideology is good, pro people, and women also are there, something will happen, In Kerala, because of the left ideology, we gained something. Not only the left, the democratic thinking, if it is scientific and if they do good things, that will also work out. In India, after independence, if Congress worked for actual democracy, I think throughout India, if land reforms happens at that time, central government have land reform acts and procedures, this feudalism and this caste disparities will go away. They didn't do it. That democratic revolution doesn't happen. That is why we left parties are saying about the People's Democratic Revolution. But we are few. Only in 2 or 3 states, and in other states leftists are working, but they cannot come to the power. And that is why it is not changing. The feudalism is here and the caste disparity is here. All the false beliefs and superstitions are here. Even in this century, after 75 years of independence, people are saying that the cow dung is best for COVID treatment, That is the fate of our country, Without changing the mindset, nothing will happen. So, policy should change, mindset should change. All people are equal without the discrimination of caste or religion. Indian citizens should have to enjoy their rights we stated in our constitution. That is the most important thing. In Kerala cannot stand as an island, I say, because it is a federal system and Kerala is only a state and the tax division or sharing is like that. But Kerala, we tried our best to change something. The open caste discrimination is not here. And Renaissance period, there are so many social reformers like Sri Narayana Guru, Ayyankali, etc. And so many political activists like E.M. Shankaran Namboodiripad, A.K. Gopalan, M.R.B. V.T. Bhattacharya and Arya Padlam. So many ladies are also there. They worked hard during that time and we achieved some rights to wear dress, to walk in the common street and to enter into the temple, etc. Now someone is trying to pulling it back to that dark days. That we cannot agree,
Coming to this same topic, we see communal tensions and polarization rampant in different parts of the country. In the last few years, it has increased and it is getting more intense and it is getting more open. And how does Kerala government manage this?
Yes, we are holding our thinking or we are insisting people that we should be secular in our state. And there are so many religions here. I think in our country more than 6 religions are there. Hindu, Christian, Islam, Jaina, Buddha and Parsi, etc. If the people try to quarrel each other or one religion try to suppress the other, there will be a struggle between them or violence will come through that and we cannot say safe. And we have more than 6,400 castes are here. Different systems of marriage and different system of eating habit is also different, etc. All these disparities inside all this or among these disparities, we should have one thing. We are all Indian citizens. We are working for our country and India is our country. India is our country, not a Hindu country, not a Christian country or Islam country. India is our country. During the independence period, Rabindranath Tagore wrote a poem like that, where the head is held above, where the knowledge is free, where the narrow barriers will not separate us, into that heaven of freedom. O Lord, O God, let my country awake. And did we awake to that heaven? That is the most important question. We are Hindus, we are Muslims, we are Parsis, we have several castes and we are discriminating people according to that. And this religious fundamentalists are taking some gains out of it. They are prompting all the jadis and they are acting like they are helping the jadis or jadi identity. They want to develop the jadi identity, but they are not helping the jadis or the members of that caste, That is the election-oriented politics. They want to have power. To get that power, they should have some vote from these downtrodden people. And the poor, sometimes they will give a little bit this seat to them. That is not sufficient. If a poor caste, these fundamentalists are saying, we will build a kovel for your God. That's a small thing, They are building huge mansions. But for this poor caste, they are building a little thing. But they think that we got this and they are for us. Cheating them actually. They are not giving proper education, proper job or proper opportunities to move freely. But they are cheating them. They are going behind these fundamentalists, behind the superstitions and false propaganda they are going. That is the fate of India. The people should understood that where we standing and what is our aim, and how should we build our country. That is a huge task. That is that without change in the mindset, we cannot achieve that thing. India should become scientific. Scientific thinking is the most important thing. Then only we can change our mindset to this love for all human being and the identity as a human being, not identity as Hindu or Islam. That is the private thing. They can get their prayer in front of their gods, anytime, anywhere they want. That is not the problem. Problem is that one group is suppressing the other. Don't do that. Don't come here like that. That should be stopped. The believers should have time to or space to give their pray in front of their God according to their wish. We cannot prompt them or compel them to do this thing and that thing. But they all should have to work for the country together. For the common thing or for the common purpose, they should unite. That is the unity in diversity. And if we cannot achieve that unity in diversity, India will collapse. That is going on. The dangerous things are going on.
This brings us to the question of what next. All the political parties have begun preparing for 2024 general elections now, and the opposition parties, different opposition parties, are deciding to put a united front. What is CPM's take on that, and also what is CPM's take on the Bharat Jodo Yatra that Congress has started, which has reached Kerala as we speak?
Everyone should have to try, the left and democratic parties. We are not against any individual or that kind of thing. We are against the fundamentalism, false belief and anti-people propaganda and the capitalist mode of exploitation and feudal mode of discrimination. We are against that thing. And if anyone want to oppose these things, should unite. And the unity should not be for election purpose only. Election, some alliance will occur to get some votes and get some seats in the assembly or some berth in cabinet. That is not the actual thing. We should unite for India, India's democracy, to save India's constitution, save secularism, etc. Without discrimination of the sex also. Men, women or transgender. Transgender should be considered. They are also have the same rights as women and men, male and female, and they should also considered without any discrimination. We have to enjoy the rights as a citizen. For that, we should have unite to fight against the fundamentalism, fight against the false belief, and to get scientific culture. That for that, all the democratic people should unite. Election is also an important thing. In this election, I think all the democratic parties or fronts will unite, and the CPIM leaders are also saying that, General Secretary and our veteran leaders are also saying, in PB members are saying this. They put forward this aim in front of Indian people, population, that we are for saving our constitutional rights. And I think there will be some movements like that, but sometimes it happens only to get some seats or berths. That will not work. There is hope. The people will think about that.
So it's a slightly question about your personal take on something. So at the time after the pandemic, you were hailed as the COVID slayer, as the virus slayer. You got appreciation from across the world. But when LDF came to power in Kerala for the second consecutive term, we saw a lot of media reports. We saw a lot of displeasure being expressed in media about why you did not get a position in the cabinet the second time. And something similar we have been seeing after the announcement of Magsaysay Award. So, what do you think about such takes about the party decisions that we keep seeing on social media, through media, and what do you think about it?
I am not a virus slayer, Viruses are here and there in the universe. Sometimes it will become very, very cruel and infectious. Sometimes it will not. And it is here. We should have to prepare to tackle or to fight against this kind of things. That this is a great challenge during these days. And in 2020, we worked hard to suppress or to make it down, as we said, to contain these things, and we got a very good result out of that. During that time, the whole world was suffering. Most of them accepted the mitigation method, even in UK and Sweden, etc. The Prime Minister of Sweden said once that don't imitate us. We were wrong to accept this mitigation method. We didn't prevent it. That at that time Kerala was preventing the virus, breaking the chain, etc., and that work gave a good result. And at that time, an interview with Laura Spinney for the Guardian, she put it as coronavirus layer like that. At the time also I said Kerala have a bulk of expatriates who is living outside, and when they will come back the cases will increase. But we prepared. Because of that preparation, we can put the mortality rate below 1%. That is, and no one died without getting oxygen or a bed in the hospital. All facilities they got. That is the difference that we can say. And a person alone cannot do anything. I have a very good team with me, and our government chief minister was very brave to tackle this kind of things, and he declared the spreading. At that time he declared health emergency here, and also, as I said previously, that package, and he had hold on all the departments and make all the departments to do something to contain this virus, and that joint activity helped us very much. And that is a collective thing. And as a person, I was the health minister at that time, and I lead the health team in front. And that part we achieved something, and to make all the health community active, and they were very active and they were very enthusiastic at that time. And that part, some people appreciated me that you are doing a right thing, etc. That doesn't mean I alone was there. It is a collective activity. And the other thing, the awards and other thing, sometimes some appreciation will come. And you asked why I didn't continue next time. No need of that. There are so many persons like me in the society. Anyone can come and do as their wish or as their will, and they can make a difference like me also. When I accepted or I this position as health minister, I was only a political worker. Previously, 3 times I become MLA, member of Legislative Assembly. I was not minister at that time, and I was working in that portfolio and that canvas. I do some works. When I become minister, I worked as a minister. And if other lady or other men come to this position, they also will work. That is, I worked hard sincerely, and this means I should continue the next time also. I didn't continue, and now I am working as a member of the Kerala Legislative Assembly and also Communist Party of India Marxist Central Committee member. A huge work. There are lot of works to do. If we are ready, there are lot of things to do. The question is whether we accept or not that thing. Whether we are ready or not. We cannot sit silly. We should have to do anything, and I am doing. I believe that there is something. There is some space each and everywhere. We should accept that space and enjoy with that space and do sincerely. Then we never think, oh, I am not there. I am not in the cabinet again. That will not help us. Then we lost every enthusiasm and every inspiration. We cannot do anything thinking like that. So that is the thing.
Thank you so much, ma'am. Thank you so much for making time for us. It was great talking to you. Thank you. So that was KK Shailaja. Thank you for listening to Indie Radio. If you liked the interview, don't forget to subscribe and share. For more news, audiobooks, and podcasts, download Indie Radio or log on to www.indiejournal.in. Also consider subscribing to listen to our premium shows.